Good morning and welcome to Sirat's first podcast. Today we're talking about speech and we have two very special guests with us. We have Roopa and we have Suraj here with us. Can I please request you to give your introductions to the viewer?
So I am Suraj, also called as Subramaniam. I'm a speech language pathologist. Specializes in the field of cleft related anomalies. So I've spent my last 15 years of professional work, doing research in the field of speech intervention for children with cleft, and have got interested and then continuing my work in treating children with cleft lip and palate, children and adults with cleft lip and palate, primarily addressing their speech-related concerns, and also work with the interdisciplinary team, play a very important role in identifying the patients at the right age where I need to take in for speech intervention, or on the other side, hand it over them to other professionals and say, you finish your job and then I will take. And these decisions make an important decision in those individuals who need the treatment.
I'm Roopa, also like Suraj, speech language pathologist. I have been working with children and families with cleft for now almost 25 years. We started somewhere in 1999, recognizing that there were not much in this country available for children who were born with cleft lip and palate with reference to speech. And so over these years, I've had the pleasure, the honor of working with families and children, helping them become better versions of themselves, reaching their aspirations. And of course, working with a fabulous group of professionals in this country who have also rapidly evolved over the last couple of decades, surgeons, orthodontists, social workers, pediatric, dentists, pediatricians, social workers, speech pathologists, so many of them. So I've really been lucky to be a part of this growing community and see it becoming vibrant. So it's a pleasure to be here. Thank you for inviting us.
A brief introduction about me. I am Ashim. I am the co-founder of Sirat. Sirat is a community of Cleft Warriors and their families. I was born with a cleft lip and palate myself. I have gone through 6 surgeries, dental treatments almost every other month, which was a little harder because my father was in the army, so I've moved cities every 2 years. I've undergone about 8 years of speech therapy, which is why I'm able to talk to you and you all confidently.
Yes.
And today's topic, we want to talk about why is speech important, and someone who's listening, and I've said even some more context, right? Who is watching this video? Someone who either has a cleft lip or palate, or a parent of a cleft warrior, right? Now, someone who's a parent or someone who's a cleft warrior themselves, and I can at least talk about the experience of a cleft warrior. When I used to have bad speech, it took me at least 3-4 tries to convey a basic point. For if I had to order a coffee, it could have taken me 4 tries to ask for a coffee. And that not only, that doesn't convey the point one, but that humiliates my own self, right? So the objective is someone who's watching this video, what will they learn out of this about speech, and how can they improve their speech, who can they go to wherever they're in this country, right? So that's the context and our objective for today. So we'll start with a very simple question first, right? And I think I would like to hear both of your views one by one. Why do you think speech is very important for a person who's affected with cleft, having clear speech? How do you define clear speech? I remember having this conversation with you over the phone,
Yes.
and I really liked your answer. I would like you to maybe start then and give your version of what is defined. How would you define as clear speech for someone who has a cleft?
So clear speech is very subjective. Okay, what is clear to you may not be so as clear as to other person, and it keeps changing. So I try to have a conversation with the parents, patients who I meet. There are two aspects which I have learned from clinical research, and I'm trying to put it into clinical practice where a patient can understand what we are trying to say. So we will leave the comparison of normal and children with cleft. We focus only on because that is what I have to work. There are two aspects in speech. Is my speech understandable to others? Number two, is it acceptable for others? Acceptable is that your speech is clear, but you have a bit of nasal twang or something like that, where the person who's listening to you stop focusing on what you are saying, then focusing on how you are saying. When that how comes, that's where acceptability comes.
So it's like what and how.
Yes. What relates to understands. What did he say? Am I understanding? Hey, how he is saying. That is what comes to acceptability. So when I have a conversation with parents or children or adults, this will change, what I'm looking at. And this is what will be the core, work which will go under, the speech management. So I think that's the easier way to say, because each person comes with a different set of problems. But if you look at as a broad, both can be fit into this.
Okay.
And when I try to explain it to the patient or a family, they try to understand what I'm trying to say, rather than giving some technical details, giving them some case here. And this works really well with adults because they have the ability to understand what I am saying. And all the speech therapy should start with some conversation. It's not that you come, sit there, we will start practicing. You have to understand what patient wants. Most of the time, clinician decides the plan. The plan should be mutual, and that's
So
what.
saying that everything is personalized. It should be personalized,
Yes.
and it should come from the individual itself.
Yes.
So now, if I approach both of you for helping my speech, right, you will look at the what, right, and first you will understand my goal. Ashim, what is your goal? So I tell you that I want to be confident in speaking to a large number of people. I don't want to feel nervous. Like you're saying, there are two parts. One is the what, and how do I assess the what part is what I want to communicate to you both. Are you understanding it?
Yes.
Is that the correct way to measure it?
I think this what and how, I have a technical way of measuring. I do a proper assessment. I document what I say. And when I want to translate, when I have to counsel my parent or patient, that's where this assessment moves into understandability and acceptability. So I use it because patient or the family does not need to know whether it is hypernasality or a concept. You don't need to know technical words. This understandability and acceptability makes them understand what I am trying to say. And that is very important in convincing a patient or a person to get into the speech therapy protocol, because it's a long process. If you ask me that I want my speech to be clear in a meeting or in wherever it is, that's the long-term goal you are giving me. And I have to reach there, in blocks. So what I will do is I'll break the long-term goal, break it into small blocks, work with you. And speech therapy needs time. I cannot do magic. I cannot do magic anytime. And it's a behavior. Behavior will change when acceptance starts from the person whom we are working. When you accept that, that's the difference which I have, and that's where the speech therapy starts. Is there something which you would like to add?
I just want to say this, adding to what Suraj just now said. The concept of clear speech is a very subjective, he said, but it's also a very social aspect. Okay? So when you just think, we work with, or we all know, we have friends, we have families across this country. Each one of us speak the same language slightly differently. We have different accents, we have different speed, we emphasize different words. if I go to North India, they speak English very differently from how I speak. But that hasn't impacted the way I understand their speech. Right? So what I want to say is this concept of clear, or dare I say the word, acceptable normality in speech is very wide.
Correct.
Okay? And it's really important for individuals with cleft or families with cleft not to have some unique, perfect model. I want to sound like Shah Rukh Khan or Amitabh Bachchan or anything like that.
Yeah.
Need not be your goal.
This is quite often a benchmark.
Yeah.
that I say.
The point is that even the people without cleft may not be able to speak in that manner.
Yes.
And there are many people with many different speech issues, like Suraj explained. Children with cleft may have, some issues with nasality in their speech. It sounds a little bit nasal, But you think of a language like Malayalam, which is already quite nasal in nature. There is nasality more acceptable than other places? Possibly. So I just want to say that there's no normal, there's no clear normal, there is a range. We must have expectations to improve, to feel comfortable with who we are, and not feel different in our society. And as we migrate, as we move, as we translocate, like when I moved to America, I started speaking with an American accent. It happens to us. As we grow and evolve, we will learn to maximize. If sometimes you're not able to, there are speech pathologists who will help you through that process. But it's important to know what that clear or what that normal is in your mind, not have unusual or unrealistic expectations of normal.
Based on what you were saying, I just thought of an example, an analogy. Like when we travel outside the country to a different country with different language, let's say if I'm going to France. Now, if I don't expect myself to know French in their dialect, in their fluency, and this is where your point comes in very handy, that it first matters the what. Am I able to communicate in maybe some sign language or some English words so that the other person understands that I'm asking for a cup of coffee?
Yes.
And then it comes around the how am I speaking? And I'll again iterate on the point that man made, that it depends on your personal levels or benchmarks. My father, to this day, tells me that I should consider another surgery for speech, or I should take some speech therapy. Earlier I used to listen to him, but now that I'm able to convey all the points that I want to make, and I have received great feedback, not just from family, but people who I don't know, I think that's a very functional test for me to realize that, okay, speech is a medium to communicate. So if that's happening, I don't have to worry. Right? So if there's any Cleft Warrior who's looking at this, I think you should focus on what they said. Focus on can you get your point across? And do you accept that speech? And like man said, do you want to improve? If yes, then now we'll find ways how to improve that. But before we move on to that, both of you mentioned about timeline. It's not magic. It takes time. And I know it's subjective. But could you elaborate on what are the timelines? Let's say someone approaches you today. In the next hour, someone approaches you, they call you, hello Dr. Suraj, I have come here and I want to improve my speech. Let's say they're a 15-year-old Cleft Warrior. They have a lot of nasality. I know I'm sort of adding nuances, but we just want to understand the process and the timelines. How should they think about timelines? Not that we're trying to prescribe a timeline, no, but how should we think about timelines?
Okay. So, taking the case scenario, the scenario which you have given, a 15-year-old adult coming walking into the clinic with primary objective of speech.
Correct.
That means we start from an understanding how the structure is working.
Okay.
So there is a set of procedures which we need to do. Okay. There are two aspects I would like to start with when I first meet them. So I would see how are the pronunciation skills. Is K is said as K? Is T is said as T? Is, all these sounds I would like to see. And then I would allow myself to listen and say, when he is speaking, when he or she is speaking, am I able to understand every bit of information? Okay, that is one part of assessment I will do. The second part is, how much is the nasality contributing into this conversation? So based on this, I will make a decision. And if the nasality is equally there, and lots of pronunciation errors, we call it as when the K is produced as all of that, that is something which needs immediate attention. So I will go ahead, do a nasal endoscopy or fluoroscopy, and then see how the structure, velopharyngeal port is functioning.
Sorry to interject, but maybe not everyone will understand what an endoscopy is.
Endoscopy is a procedure where a small scope is inserted through the nose, and then we will have it placed right above the structure called velum, and then that is very important in controlling the nasal resonance and also getting the pressure during production of P, T, K sounds.
Is it a way to image what's happening inside?
It is a real-time visualization of the structure. So
the
what?
back of the mouth.
Yes.
Like
Back of the mouth.
Yes.
Near the throat.
So it will give an aerial view like this,
Okay.
and then we'll get to see how the structure is moving.
Okay.
And the patient will have to speak.
Oh,
during the
and
entire
you're teaching them
procedure.
how the airflow is moving.
No, how the structure is moving.
The structure movement is very important for closure to allow air to come through the mouth rather than come through the nose.
Okay.
And that's very important.
Because when it comes through the nose, it gets nasal.
Okay.
So when you're saying a ka, the sound has to come through the mouth. But
Okay.
when I say a na, it can come through the nose. So that movement is very important, and that is visualized using this scope. It's a tiny little tube put into your nose, rest a little bit, maybe 2 inches to 3 inches inside.
Yeah, it will go, it's a small part of the scope will go and then place.
How
When you-
specialized does one have to be to carry out this? Because my question in my mind is, not everyone will have this skill set, right? So it becomes very important for someone to then find someone who can do an endoscopy.
See, most ENT doctors or surgeons will do this endoscopy quite naturally. It's part of their training.
Oh.
But the part where the speech pathologist comes in is to figure how that structure is moving for speech.
Oh.
And therefore, having a speech pathologist available, in India, generally speech pathologists don't do this independently. Everywhere in the world, speech pathologists can do this endoscopy on their own. In India, the medical council doesn't yet allow us to do it independently. So we would do it with a surgeon, sometimes with an ENT doctor, with somebody.
Okay.
But the speech pathologist, the speech therapist is important because they know how to look at that movement for speech. So there's a particular set of sound, there's a protocol. And that interpretation the speech pathologist makes. That interpretation is not done by the surgeon. The surgeon looks at it to see, in surgery, if I had to do something, what could I do? What is moving, what is not moving, etc., etc. But it's a joint effort.
Okay.
Ideally, it is done by the treating team,
Yeah.
not by individual standalone professional.
So you were continuing with your answer because I want to get to this part of this joint thing, but you were giving us an answer.
Yeah, so going back to my answer, that's very important. That closure is what determines how resonance, the nasal energy is, and how much they're able to build up pressure. And then that is very important for me to eliminate this sounds and the nasal resonance. And that assessment will be the decision-making process. And I will have to sit down and talk to my orthodontist and also my surgeon together because I want to know, is there any orthodontic treatment which is done or left in the middle or something like that. There are multiple things which I would like to see. Is there a fistula? Is the palate positioned in the correct way? Is the teeth are aligned in the correct way? To have a proper speech, the cavity should be as normal as it should be. And that's what this timeline is very important. And once I get convinced that I know everything is ready for me to start speech, I will start speech. If I understand that there is some surgical intervention which is required, especially for the velopharyngeal port, I would like to start the speech only after that. Because it is not advisable to start something when it's like you have a overhead tank which is leaking and you want to keep filling the bottom. It's like you're draining, right? So I would like to have it treated and then start therapy immediately. In my protocol, in our protocol which we follow, we start therapy the next week itself. In our protocol, we would like to start therapy immediately after surgery. And there are patients who come from very far. I give them a teaser sessions before surgery so that they try to practice with me what I'm trying to tell, the concepts, everything I teach before surgery. And then after surgery, I help them to practice and simulate.
Okay.
So all the hard work I do before. And after surgery, the time which they give me, I say, do you remember I said this? Do you remember I said this? I would like to meet them, intensive means every month, 5 days they give it to me. I will have a plan for them, I'll work on them.
So, Dr. Suraj, you talked about assessment part, right? A few practical questions. One, I think a lot of people will be interested that if they have to, let's say, come to you, where can they come? Where do they have to come?
Okay, so if they have to come to me. So, I work in a Cleft and Craniofacial Center, leading the speech part of the program. So I can leave the contact with you. They can reach me through Sirat, and then I will be happy to do whatever we can do. But when you come into a speech pathology, consultation, I would suggest that come with open mind, come with an opportunity to give a space for discussion, so that's where learning starts. The cleft is a complex problem. You will come to me, I will do an assessment and say, can we have a conversation with orthodontist, and then that means I have identified something which will stop my course of action, so I would like to clarify. I may say, can we have a discussion with my surgeon? So it is not that I can decide, but when we talk about comprehensive, in my assessment, I try to bring that element. Because speech can be worked only when I have the rest of the structure is done, which is available for me to do what I should do.
So if someone is coming to you for an assessment part, in their mind, and this is someone who's not, let's say, in your city, right? Let's say they're coming from a smaller town. How much time should they mentally have with themselves? Will it take more than one visit? And I understand from what you're saying that the assessment might require meeting the speech language pathologist,
Correct.
an orthodontist, and maybe a surgeon as well, and even more people, right?
Correct.
How should they mentally prepare themselves for the assessment part?
Yes.
We come to the speech improvement part.
Yes.
But the assessment part, how should they prepare
Yes.
themselves?
I think you asked the correct question. I think Professor Roopa was also mentioning that. That's where I use the hybrid approach.
Okay.
So when somebody is talking to me and they want to come and meet for an assessment, I would first meet them online. I will have a conversation with them.
Okay.
I will understand what is the problem. At least 30 to 40% I will understand. And then I will tell them, say, this is what I heard today. This is what can happen during my assessment. And when you come, I will need about 10 to 12 days or 5 to 6 days. Come and spend some time. 10 and 12, 5 and 6 are just numbers which I am
So, can we say 1 to 2 weeks?
Not necessarily.
No, I'm just giving you a number. That video call will give me an estimate of how much time they should stay with me. Because I will talk to them about what surgeries they went through, what is the stage of treatment there. I get all basic information. From there, I will know how much time I will have to spend with them.
I tell you why I'm asking this because we get a lot of warriors in our community who want to improve their speech. Now, we want to, let's say if I want to connect them to you, and they are also now, like you said, they might be in a school or a college or they have a job. How much finances should they budget? Let's say if they're coming, I get them on a call with you, right? Now, how do I put it? Because we get this question a lot. How much money will it take? How much time do I have to put, right? And it's not, from what I'm hearing, it's not, I can't tell them, oh, it will just take one day. No.
Can I answer that question?
Yes, please.
There are two parts to your question which I think you haven't separated.
Okay.
One part is the assessment part. The other part is the intervention, the therapy part. These are two relatively independent things. I can't do therapy without doing assessment. So there is a time and cost for assessment, which, as Suraj nicely pointed out, is not necessarily just a speech therapist assessment for speech, could involve other professionals. And you have to work through, depending on the cleft clinic you go to, their schedule. Like my surgeon won't be available on a Tuesday, my orthodontist will be available on a Wednesday, I am available on Sunday. So if you do the online meeting, that little procedure is set, this protocol is set. I would think ideally 2 to 3 days.
Okay.
You can usually do what you want. Maybe it may go up a little bit more.
Okay.
The cost varies from city to city, clinic to clinic. Sometimes it costs you nothing if you go through one of these major charities. If you go to a private clinic, it would cost you something. Bombay may be more expensive than Madurai.
Okay. Yeah.
Okay, it depends on the level, but we would always advise people to go to a good cleft center. As far as intervention goes, okay, once you've said everything healthy, and Suraj can correct me, ideally if you're looking at intensive, and I say intensive, we are talking about being able to do 5 to 6 days at a stretch, okay?
Oh, okay.
Right? Or at least 3 times a week or something like that. Ideally, we are looking at 18 to 20 sessions. Am I right?
Yes.
Depending on the goals we have set. Depending on the goal. If it's if it's got multiple issues, then it take longer. If it's just a small thing, the capacity to learn, the status of the speech. But you should give yourself a few weeks time. Because speech therapy is not just about learning how to say a sound. I can teach you to say, put your tongue here, use this process. But it's about integrating it into words, into sentences, into your conversation. You naturalize, making it natural in your speech that you don't think about, am I saying that curve properly? It's just coming.
Okay.
Right? Because speech therapy starts with teaching you at the very sound level. But that's not our goal. Our goal is for you to be able to use it without even thinking about
Correct. The habit.
Yes. So that habits take long to
Takes time.
And much of it you can do at home. You don't need the speech therapist hand holding it. But not everybody is capable of reaching there on their own. So a lot depends on the person. But I would really say you need rapport with the speech therapist. You need 2-3 weeks out there.
Something Ashim. Speech therapy is an ice-breaking session. The first meeting which you have, it's an ice-breaking session. I have had instances where I have dealt with 27-year-old, 26-year-old coming to me and say something we should do. As a speech therapist, I have to break that myth that I'm not able to do.
Yeah.
When they leave me from that period of session, I will take one small goal where the patient feels that I have learned it. And that's what is going to bring him back to me. So as a clinician, always, you start with a small goal and show that you have made a change. I don't take big goals. I identify what are the things. This is what we will start. And I will see how much you progress. And about 70 to 80% of the time, I progress in the first goal which I take. And if I do that, then their compliance is going to increase. Second part, which you have not answered, I would like to take the liberty to answer.
Yeah.
I work with mothers a mothers of children between say about 12 to 36 months. It's important to talk to them about how to speak, what to listen. We spend a lot of time talking to them, making them understand that how speech develops, what they should do. Because mother will understand everything. And then she'll say, give. But I'll tell mother, Mama, listen, he has to say ka. If he says you know what you should tell? Oh, did you say ka? So you give the correct feedback, and that is very important. Correct it when the child is learning. If you leave that time, it's different. So we have programs for mothers between this particular period who have got their child palate operated.
You mentioned 12 to
36 months.
1 year old to 3 year old.
1 year.
Usually by 12 months, palate is operated. However early we do, that's it. Here in our clinic, we have a protocol that 12 months when the palate is operated, we see them immediately after surgery, give them a plan. At 18 months, we have a follow-up. You have to come to the clinic after 6 months after surgery to see how the child is. Next visit is 24 months. Next visit is 30 till 36 months. We have a follow-up where we identify the child track, and it is important to put the effort at an earlier stage to see the growth, getting normalized. On the other hand, we have people who have missed. And when they have missed the timeline, I'm not going to make them feel guilty. I said, come, let's have a conversation. But it is a time-consuming process. We both have to invest. These are two tracks which are very important.
I think Suraj is trying to say is if you're able to set with the structure that is corrected to surgery, if you're able to set correct patterns early, it's normalized. If you have an older child, you have to unlearn that abnormal placement and relearn a new placement. Now, children are very pliable, they learn. I mean, we've seen 25-year-olds make changes. So, change is not impossible. Change is more difficult. There's an unlearning and a relearning process. And it's really important for very young, parents of children born with cleft under the age of just newborn. Come to the doctor. You're so concerned about, the facial structure. Nobody, even at that time, realizes this child has to speak, and this cleft can impact the child's speech at that time. When the baby is so young, your entire process is only all about, have I had my surgery? Is my child feeding? Is my child growing? Those are the things. And children don't speak. Generally, we don't look at children's speech, parents and families, till the child is about 12 months, 18 months, They're not worried. And then when the child's speech doesn't sound or is delayed or voice doesn't sound okay, they start getting worried. And that's what Suraj is talking about, the need to counsel the parents at 9 months, 10 months when they've had surgery to say, hey, the next thing is speech. Make sure the child is getting correct production. Encourage the child with correct production. And you don't need a speech therapist for that. An empowered person at home, parent, grandparent, somebody can help the child. And those cases, we really find at 3 years, there's not much to differentiate them from Now, doesn't mean they don't need to see the cleft team at all. But the effort you need to do for later work is much less. And that's been the remarkable part of the program in India in the last 20 years. When we started working, at least when I did in 1999 to 100, it was not uncommon for us to see an 8-year-old or 9-year-old without a repaired, with an unrepaired cleft. Today, most of our kids are under the age of 18 months or 1 year. Which means, so much of this relearning, unlearning stuff, we don't have to do now. We can start them off. So that's the crux of it.
That's a very good point, because up until you made it, I didn't realize that when a child is speaking, right, and let's say they're not pronouncing the sound right, it's very easy to neglect it, saying, it's just a kid. He just started to speak. I don't have a first-hand experience, but we might just say that it's okay, right? But if the mother or the father knows like what should be the correct pronunciation, that will create a very faster and earlier feedback loop for the child.
Yes,
It's very easy to accept baby speech.
Yeah.
But here we are saying that you have to give them correct response. I mean, the way you respond to the child is more important than what the child is actually trying to
The
say.
feedback is very important.
very, very
Interesting point.
There are some important things which we tell the parents. I understand that you are conversing with the child. Speak slowly, Have 2-3 words in a sentence and make sure that as a parent, you give the model by giving stress on the sounds. In cleft, the P, T, K, S, SH, Z, J, these are the sounds which are commonly affected. So when you speak, let the child have an opportunity to hear the correct diction. And when the child repeats it, try to give a model. You say, oh, did you say pa? And when you are not able to, when you bring them to us, we will teach. And I will not teach only the child, I will teach also the mother because teaching pa is not rocket science. Okay? And I think I win if I teach a mother because child is going to be only for half an hour, 45 minutes. But the child is going to spend more time with the mother. The mother will try to give more information for me, and I have a role when when I know that there are something which you cannot change, where parents may not be able to do. That time I'll completely take them over to me, and these two go hand in hand. I cannot say only this will happen, only this will happen. So this trajectory can be decided based on the assessment. So assessment plays a very, very important role in deciding the treatment and treatment plan and monitoring whether treatment is going correctly or not.
Got it.
And for your viewers, it's really important for parents of young children to ask the surgeon, who can I go and see about my child's speech? Is it okay? Does it need some help? Does it need correction? Even though we're saying what is clear, what is normal is okay, it's important to keep track of that speech as the child grows. Because the face grows, structures grow. What is correct, okay today may not sound so correct after 2 or 3 years. So it's important to keep, just like you keep track with the surgeon, keep track with the speech therapist and a speech therapist who's trained in cleft. That's really important.
Let's look at it from a point of like you said, a new parent. From a parent who's looking after a cleft baby all the way to, let's say, a cleft adult, right? What is the team of medical professionals that should be there from this point to, let's say, adults, right? Because people often get confused or people see them in isolation that, okay, I'll go with this speech therapist, I'll have this surgeon. But I think, like from what I'm understanding, this team is very important.
Yes.
And the communication between this team is also very important.
That's
So
more important.
what is this team? Who is involved in this team? And does this team remain this? Do the players in this team, the individuals, do they remain the same at the start of a child's life, or do they change over time?
So let us break your question into different parts. Team is very important because if you have fever, you need to know, you will know that I'll just go see a general medicine physician and do something. Or if you have any other specific, if you have a problem with your eyes, you know that you go see. The cleft, where, cleft of palate or whatever, then automatically brings more than one player who needs to be with the child during the course of intervention. It will be very difficult for me to say, they will have to go to this person or that person. But when you work with a team, the team usually knows what the direction is, where they should go, whom they should meet. And now, the clinics, most of the clinics which I know, most may be an exaggerated word, but clinics which I know understand the role of each team member, and whenever a patient walks into a clinic, they make sure that they meet everybody. So that if something is missed by me about speech, the surgeon may say, hey, did you listen to the speech? Can you listen to him one more time, that opportunity? that is the culture which is developing, evolving, okay? And that's an important point. And that's where we are talking now, talking about a patient should meet all of them. But the treatment, will be decided based on, what is the need of the patient at that point of time. I think that makes it easier for a clinic not to miss a patient who needs a private. Whether it is ideal, but in reality, it may not be possible everywhere. Okay? That is something which, something may change over time.
Yeah, hopefully.
May over time. And there are organizations like you where people can connect with you and ask, hey, I went there. These are the things which was told to me. Is there a place where I can reflect upon? I think it's a wonderful window which you have opened up so that people can understand, ask, reflect. But the next point is action. That is what is very important. If you understand, reflect, and if you do not act, we really cannot, do anything. And I may be wrong. Please, I don't want any of the Cleft Warriors to get me wrong. For example, I'm just giving you a scenario which, as a clinician, which I face. Around 18, 17, 19, 20, aesthetics takes a very important role. Okay? When you come at that time, a treating team may not be able to directly handle aesthetics. They may have to go back and check what needs to be done to go to this level of aesthetics. So that's why we say, when you are with the team, at least go and visit your clinic once a year. Go and meet your cleft and craniofacial team. Talk to them. Understand, the stage of development. Understand whether you have missed a treatment, and that is very important. And now we are fortunate that there are many cleft treating centers across India. And if you are treated by any one of them, you should go back and see, where you stopped, what has to be done. When you are stopped in between, we need to fill the gap which was there, and that is very important. And that, as a clinician, we face difficulties. But I will say that I want to work on speech. Orthodontists will say, I have to work on expansion. The entire arch is collapsed. You have to give it a. And when it is collapsed, I cannot just say.
She's getting a call, but she was recording one to you, audio. Can you just make sure the audio is recording?
Yeah, sir.
It's going on.
Yeah. Okay.
So that is something, it's important to understand, what I have completed so far, what has not been completed. It's very important for a person. If I take 100% responsibility, I give my patient also 100% responsibility to say, this is what you need to do. And most of the treating teams which I have interacted are very open to have the patient walk in and have a check. If it is done as a team, we will say full rehabilitation completed. And you will come back to me as a warrior and say, you will be helping my clinic, motivating my other patients to help. So the timeline is very, very important.
Who are the people in this field? If you want to tell people that, these are the specialties, as an orthodontist, surgeon, could you share insights as to what kind of a team should people be looking to?
At the bare minimum, a surgeon, who could be a plastic surgeon or a maxillofacial surgeon, speech therapist, orthodontist. Bare minimum these three. Okay. Now beyond that, it can expand to multiple things. Okay. A psychologist is somebody who could definitely help in the process. Okay, for a younger child, it could be a pediatrician, because many children with cleft have additional problems beyond cleft, which also we need to keep an eye out on, to see other factors, syndromic issues. So we have to look at that. So for the very young child, under the age of 1, the more important person than the speech pathologist or the orthodontist would be the feeding specialist. Which could be a nurse or it could be a speech pathologist, whoever, because child's feeding and growth is really important, even for the welfare of the child, plus to be ready for surgery. So that the feeding specialist I think many centers have a feeding nurse, right? So, nurse specialized in feeding. So, that's really important. At that level, that's it.
So, yes, you have
Psychology.
there. We also have a very important role to play, taking care of their hearing.
Yeah.
So all children who are born, before their palate repair itself, we monitor, because the palate is open, they are at high risk for developing ear-related issues. So we have audiologists monitoring their hearing, and also an ENT professional parallelly monitoring the status of the tympanic membranes inside the ear, okay, to check how it is functioning. When they work with the team, during the palate repair itself, if something has to be addressed to the middle ear, it can be done. That's the advantage of working with a team where we have multiple people. This team member is evolving in different places, different people have different mechanisms of working, but these are the most important people. And I also want to tell from my experience, pediatric dentists play a very, very important role.
Okay.
If orthodontists have to work at a later stage, they should have teeth free of cavities, caries, and all of that. In our Indian practice, you have milk with sugar, give the baby, and then the baby goes to sleep drinking the milk. And then, it's sugar, right? Over time, you are going to, this is pediatric dentist role, I'm just talking from my experience of working in a team. This is the knowledge you get as a professional when you work with the team. You know what they speak. So when they do that, they don't care of the dental hygiene, oral hygiene at all. So we talk to them very early about what they should do to take care of their teeth.
Just like I said, parents don't worry about speech. They say, 1.5 साल के बाद बात करेगा. He'll speak after 1.5. Why should I worry about speech at 9 months? Child doesn't have teeth till 1.5 years. Why should I be worrying about his
Cleaning,
oral hygiene? So it's really, there's some small processes you set in place. You prevent larger problems later, and like you said, adjustment of this timeline.
Yeah.
The orthodontist will say, first go get your carie teeth fixed before I will do any work.
So that's where most of the treating team, when you bring a child at 3 months, 4 months, they follow the surgical protocol. And there is one of the other professionals will have a 1 year follow-up for sure.
Yeah.
Till 5-6 years, either they will be doing something. And that's very important to make sure that the child is. We usually, most of the treating teams will have the logic. Yesterday, I think we also heard from someone saying that most of the vacation will go to meet a professor, because that's very important. We do not want the child to miss the school, right? And we get to see, we get to plan, all those things. So once a year follow-up between 0 to 5 years is very important. But if your child has only cleft of lip, all of those rulings not apply.
Yeah.
So once the lip is repaired, you're done, and you come back to the clinic whenever you think you need a aesthetic improvement or something like that.
So I think the most important message in the last 10-15 minutes has been that the team of medical professionals is very important, right? And the team evolves over time. And again, from the starting, we've been saying it's subjective, so every case is different. The team, every case requires a different set of people. But having a team is very, very important.
But if you're at a place where you don't have a team,
Yeah.
let's say you have only a speech therapist and a surgeon. Ideally in India, we will have teams, but we may not have teams with all members all the time. Don't be afraid to ask for a referral to somebody who can give you that help.
Correct.
And go to somebody who has some experience with cleft.
Correct. That's a very good advice for people with cleft and their parents. Ask for help.
Yes.
Right? Please ask for help to your medical professionals, to people around you. And now that you have communities for cleft, you have community events for cleft.
Yeah.
Yesterday, during the CleftCon, I was just thinking like there could have been another world where there were no events for the cleft, right? So we should be grateful that there is a community, there are events happening, people are working to celebrate families and people with cleft. So that makes us very happy. In the interest of time and also some logistical issues, I think we have about 5 minutes.
Okay.
Right. One question that I think is very important again for speech intervention part, which you pointed out, is that you give people a milestone, a goal. Can you share some examples? Again, I know it's a very specific question. Everyone could have a different goal based on their individual ambitions. But could you share some examples so that people can understand, oh, okay, this is a kind of a goal that maybe I can think about?
So the goal is something which a professional decides. The need is what a patient brings to me. Okay, so I would like to identify the easiest achievable goal, something which we can demonstrate, because confidence building. You need to show that the patient can, or the person who needs can make a change. Therapy is all about making a change. And the why I'm asking this assessment, which is important before therapy, is to identify which is the first easiest goal or target which I can take, so that the patient, for example, something, this consistent air is coming out, it becomes very easy for me to make them teach. I have low-tech devices which can help me to make them visualize that how much air is coming through the nose. And I can teach them strategies to see how it can be corrected. If when I'm doing an endoscope, I will also share a video with you, maybe after that you can play it in your thing. When you do an endoscope, I will be able to see whether there is a gap. When there is a gap, air is going to easily come out of it. And I know that I can give a feedback to the patient, see, this is coming through this gap. If I don't correct that, I cannot correct this. So that's the way I go about counseling. And once they correct this, the structure, air will still come because the function they have not yet learned. So again, I will show it to them. I'm doing this, it is moving, but the air is still coming. So I'm going to teach you exercise on how you will control. And as I'm teaching, I'll have a recording of the entire session. After the session, I'll play it back to them and say, this is what you did, this is good, this is what you need to try. And that is what is going to give us feedback, and that's going to stay with the patient forever. What he has learned new. Because when you learn something new, you don't let go of it very easily. You keep it with you very tightly and very closely. And that makes a big difference. So identifying that first achievable goal, which can make a big difference, is very important in the decision of, in deciding compliance and outcome of therapy.
Correct. Another very important question that popped up in my mind is, during the intervention stage, a person with cleft or the parents can only come to the speech therapist, let's say, depending on the need, but they can't come all the time because of issues with time, money. Let's say they have a frequency and you've decided that they need to meet you once a week, or let's say Wednesday. How can they use, or should they use, the remaining 6 days? And what part does a smartphone and internet play? Can they use that? And what should people do in the remaining days?
Smartphone does not replace it. Okay? Smartphone does not replace a professional.
Correct.
Okay? And I'm teaching you to talk. At home, you are going to talk. So you don't need a specific timeline, to sit down and then say. As a parent, as a caregiver, whoever comes with the child, I'm going to make them equally aware how it is happening. And I will have them to spend some time dedicated with the child, but continuously listening to the child, continuously monitoring them, prompting them. Feedback is the most important. Most of us don't know how to give feedback. Most of the people say it is not correct, you are not learning, you are not practicing what speech therapist is. They come very happily, they come and tell the therapist, he's not practicing anything, he's not doing anything. I said, what are you doing?
Yeah.
So it's that's not feedback. Feedback is, oh, you did it well. That curl, like how Sir said, the tongue was elevating very well. I heard that when you said the third cup. This morning you said chai, I heard the chur very nicely. This is what I want. When you said chur, that air came out like how you learned in the session. And today I think you spoke fast, because of which I didn't hear the K sound correctly. Maybe you should remember how you learned in the session. This is how I feedback I would like to see. And as a parent, I tell them when they say it correctly at home, no, please make a video recording and bring it to the next session. So I can also give feedback on how it happened at home.
Yeah.
Because I think the video recording is more important than an audio recording, or does it not?
Now you have a phone, you can easily do a video recording.
Ideally video, because we can see what they are doing.
How they practice.
I just want to say, to reiterate what Suraj is saying, see, speech therapy is about behavior change. I can give feedback. Feedback's really important. But ultimately, you have to internalize it and you have to hear yourself to say, is this right or not? So if you keep on saying, for k, and you're waiting for me to tell you that's right, that's wrong all the time, it doesn't help. So it's really important in the process of therapy is to allow you to hear yourself. Did this sound okay? Is there a better version of this that I can produce? So when we say, try it again, let's try saying it again, it's to help you, redo that process and be able to say, okay, did I do it okay? Did I not do it okay? And it's when they, for example, very simple, when you're learning spelling, they give you dictation. If the teacher corrects the words and says you got 7 out of 10, you don't learn anything. But if the teacher says, here are the 10 words, find out what is the mistake you did. You have identified your mistakes, right? You've taken the child beyond, I got 7 out of 10 to these 3 I got wrong, and then what did I get wrong? Same thing. Therapy is very, very simplistically at that level. You have to change your behavior. You have to internalize it. You have to listen to yourself. You have to we'll give feedback. At some point, we'll fade it and we'll ask you, did that come out well?
Got it.
Automatically, when he accepts your speech, it will be okay. You'll say, oh, that was okay. So it's really important to involve that also. If you we should keep on correcting. That feedback is very important. The child's effort and understanding is okay. He was saying, listening.
Correct.
Is really important.
So, to summarize the answer to this question, I think on the days that you're not meeting your speech language pathologist or speech therapist, you have to still deliberately practice and have someone listen to you. Because to learn, to make a change mentally, and that's what learning is, to change habits, you need continuous feedback. And feedback can't just happen every once a week. It has to happen continuously. And that's also where your friends and family and people who can support you come into the picture. They're very important. Like they're able to give you the right kind of feedback, the right way to deliver feedback. And the answer to how do we use technology and smartphones is one very basic use. Make a video to show your professional what is happening. That is a good way to show. And if there are any other tools, or let's say any words that you need to practice, then people can use internet for that, right? But I think what I have learned in this that it's more important for people to be around and to deliberately practice and get that feedback, right? Would that be the correct summary?
Can a smartphone give you feedback whether you said it correctly or not?
I haven't heard of it yet, so I guess.
I don't know when we will reach there, but people sitting next to you will.
They can.
So let's use sustainable resources.
Correct.
So under the nasality is something which you cannot correct through a phone. You have to sit in person and converse. So there are challenges, but I'm giving you options which are reasonable, usable, available.
Therapy is hard work, but fruits are fantastic.
I can attest that as someone who's done it myself.
It takes a lot to keep compliant.
Yes.
But the outcomes are good.
Correct. And like ma'am said, it takes time. It is not magic, right? It's not you will not wake up tomorrow and have fantastic speech. While I do not have a lot of memory of that time, but I do remember that my mother and my father were behind me and they pushed me to practice my speech daily. We used to practice through a mouth organ, they used to make me sing. There were different ways to do it, but now I understand it was just deliberate practice. And I used to meet my therapist every once a week for that for that maybe direction, alignment, realignment, what's the next level. So I think with this, I think today we've learned a lot about speech.
Ashim, can I make one point? It's very important.
Absolutely.
There are many people around who have no patience, They've taught to do blowing, sucking, chewing, and then some massages for better speech. They don't work.
Okay.
For speech, you have to speak. You have to learn the right strategies to practice.
Best practice for speech is speech.
Speak.
That is very important, and I have heard from patients across the country tell that they practice blowing through straw, they practice blowing balloon, they're blowing whistles, and then they blow bits of paper, candles.
That's what I did. I did blowing of balloons as well.
That's what it is.
Nothing worked.
It helped to speak. It helped to make some muscles here.
They may bring some strength and ability to blow, but it does not convert into speech at all.
Okay.
So that is something which is very important.
If you have a speech therapist doing that, you need to say, hey, stop this, let me get to some practicing.
So that's a very important thing which is.
Okay, so another major insight is that let's just speak, let's talk. So I think we as Sirat will also now create more opportunities for warriors to speak, maybe to sing as well, right? But we want more people speaking up, and that's what we do. So this has been a great session. We've learned a lot. I have learned a lot. One of the things about my childhood speech therapy, which I just realized was maybe not the best practice, but I have learned. And like ma'am and sir said, that it's all about learning, and you get that hit of learning something new. So thank you so much for sharing your insights of such fantastic career and fantastic experience. I speak on the behalf of many other Cleft Warriors as well. The work that you do, I'm sure you know the importance of it, but hearing it from us as well, because we're able to now go into a world where we're able to do everything that we want, right? Chase our dreams. You're enabling that. Thank you so much for that great work. Can't thank you enough.
Thank you, so much for having us. Don't ever underestimate, the power that you have to inspire generations of people to seek to become, the best versions that they want to be of themselves. And as much as all professionals can do, it's people who've had that lived experience who truly are the supporters, handholders, facilitators. And so we should thank you for not only being who you are, but creating a space for such discussions to happen. It's severely lacking.
Yes.
I couldn't connect one from another, one to another. So this is really important.
Yes.
Terrific work you're doing.
Thank you.
Yes.
We wish you really well, and I hope you'll do much better.
Thank you so much. I think if we have achieved something over years in Cleft, in rehabilitation, I think this is the conversation is the evidence for that. To have a conversation with the two important collaborators, I'm sure you will have with other team members, but this conversation is something which is very important, and what you are doing is something which you yourself will not know the impact of it. I'm sure there will be many who will benefit, not through this conversation, but the different conversation, different dialogues, the different ways of you engaging and your famous picnic. Okay, so I'm sure you're doing a great work, and your interest to bring all of us on board to have a conversation is much appreciated. Thank you.